Here, I'll say. Good morning. Today we're going to focus on chapter 4, which is body systems and related conditions. Um, this is a big chapter. It helps you to understand how everything works in your body and how it relates to the role of the CNA and the importance of understanding what you're doing, not just what you're doing, but why you're doing what you're doing. Okay? And always feel free to relate everything in this chapter to your own body. Everything that we talk about today, you're in possession of in your own body. And so use yourself as the example as you're studying, or look at your skin or look at the body part, if that helps you to visualize and understand the body system we're talking about today. Okay, today is day 7 of our CNA program. So at the top of page 82 in your book, we see the word homeostasis. Homeostasis is the name for the condition in which all the body systems are balanced and are working at their best. We all ascribe to reach a state of homeostasis. Our bodies, our environment, inner and outer, that means balance. When something is out of balance, we have what's called a symptom. It shows up.
Correct.
When you break your arm, you're now out of a state of homeostasis. Something is not working properly, and what is exhibited is pain and maybe malformation of your arm. Now it's not straight anymore. Maybe it's bent now, or maybe it's crooked. That's an example of being out of state of homeostasis. Um, and everything that we do as a CNA in nursing is to help our residents and our patients come back into a balanced state. Okay. To be in homeostasis, it says on page 82, is the body's metabolism or physical and chemical processes must be working at a steady level. So when your blood pressure is high, you're out of a normal homeostasis. When your temperature goes up or down, you're outside of homeostasis. Stasis means static.
Okay.
So understand that anytime something is not working right, your body is craving to go back into homeostasis, and you see the signs and symptoms. But guess what? You got to know what's normal to know when something is abnormal. You have to know what's normal first to know when something is abnormal. I'll ask you, what is a regular heart rate? What is a regular pulse? You should know 60 to 100 is regular. So when you saw 50, that should have alarmed you, CNA. When you saw 120, that should alarm you, CNA. Those are outside of the normal ranges. And then you know that there is something, you as the CNA who gathered this information, there's something for you to do, which is report. Okay? Gather the data, recognize whether it's normal, and report. Okay. Knowing normal changes of aging will help nursing assistants be able to recognize any abnormal changes in residents. Okay. So we have 10 body systems, and these systems go in and out of normal homeostasis all the time. Integumentary. I need you to learn these words. I need
Okay.
you to be able to say these words. Okay. Don't skim through them. Focus on your reading, because we're now in a a new environment, a professional environment, and
Right.
there's different terms. Okay. So integumentary means skin. Musculoskeletal,
Mhm.
that's our muscles and our bones. Nervous system, That's our nervous system. That's our spinal cord, our nerve endings, even our brain. Circulatory or cardiovascular, that's the blood and how it gets around the body. Respiratory, that's your lungs. Urinary, that's when you urinate, okay? Um Gastrointestinal or digestive, your gut. um Endocrine. Okay, this is a lot. Endocrine gets very tricky. It's the hormones and the glands that we so many in our body that we don't understand or know how they work, but that's what the endocrine is. Reproductive, okay, your ovaries and your testes. Immune and lymphatic helps infection. You have a lymphatic system in your body. You also have certain helper cells, T cells, and all those type of things that fight infection. That's your immune and lymphatic. So when you understand that, when you understand that these body systems function for a reason, you'll be able to better recognize those changes in your residents. Okay. Now, let's break this down, and you should write this down and understand this. Body systems is at the top. Let's say you're making notes, you're writing notes. Body systems should be at the top. And
Yeah.
then you might write a arrow down, and it says at the top of page 82, body systems are made up of organs. Okay? And
Oh, I already got. I'm sorry. Go ahead. I forgot you. Go
no, you know what? That's right. We are recording, but I guess we gonna have to they're gonna have to hear this too because you are trying to learn here still, right? So I guess and come to think of it, I may have to just record this by myself without a student.
ahead.
So, but this okay. So go ahead. What were you gonna say?
No, I was gonna say I already, got that already.
Oh, very good. You already did that in your notes?
Yeah, yeah. But I was already doing that, doing my notes yesterday.
Perfect. And that's exactly how the best way to learn, right? And so
Right.
sometimes it's visual. So body systems are made up of organs. Organs are made up of tissues, and tissues are made up of groups of cells that perform a similar task. So when you hear people saying, um, heal your cells,
Hmm.
eat for your cells, not for your taste buds. This is what they mean. Eat something that's going to be good for your cells. And so that's what they mean. So, for example, in the circulatory system, the heart is one of the organs. It
Right.
is made up of tissues and cells are the building blocks of the body. Okay. So I encourage you to read thoroughly through all of this. We're going to hit on this stuff. This is again, as you guys have learned from me in week one, this is so much of this is about reading and understanding. All right. So at the top of 83, what's the largest organ in the body?
Uh, Skin.
The skin. And our skin is a protector.
Oh,
Okay, that is why so much that you will do as a CNA is to protect that skin. If you neglect to moisturize that skin and it's a part of that resident's care plan, you are causing them to potentially go into an increased state of outside of homeostasis, meaning they could get a skin breakdown, they could get an infection, and so protecting that skin is fighting off everything all day, every day. Your skin is protecting your internal organs from outside invaders called pathogens. Remember, we talked about that?
yeah.
Pathogens, microorganisms, right? So the skin prevents also the loss of too much water, which is essential to life. So that's why we have to keep hydrated and we have to keep moving and we have to check body temperatures and all of these things, okay? Because you can compromise the largest organ system on your body, okay, which is the skin. Now, it says down there that the skin is a sense organ.
Yep.
Sense, a sense organ means it feels hot, cold, pain, touch, and pressure. And then it goes and tells the brain what it's feeling. Okay, this is so your brain, I mean your skin senses things and sends it to the brain. Okay, we have a beautiful, beautiful system here that's called our body, right? We take it for granted. So the body temperature is regulated by the skin. When your blood vessels dilate or widen, outside the temperature is too high. Okay, they blood vessels widen when the temperature is too high. Okay, and this brings more blood to the body, and then it cools off, and then it constricts when it's the temperature is too cold. Right.
Yep.
So normal changes of aging include your skin is thinner. You need to think about this about your residents when you're being conscientious of how you're handling them. Conscientious of, remember the word shearing?
Hearing, yeah.
Shearing. Why you got to be careful? Why you have to be careful of how you're moving your residents, because it says right here, as you get older, your skin is thinner. That's how you can damage their skin by a shearing effect when you're just pulling them across
Right.
the bed sheet, right? You
Right.
wouldn't just have you ever had a carpet burn?
Oh yeah.
Now, a carpet burn happens because that carpet is so tough and so coarse. But imagine a sheet being that same thing to an elderly person's skin.
Hmm.
Okay, it's the same, right? So their skin is thinner, it's drier, and it's more fragile. It is more easily damaged. Okay, so you can easily compromise their skin by not operating how you've been trained here at Nursing Detroit Training Center. Okay. Also, older adults perspire less and do not need to bathe as often. You go in there and you may come in there thinking about your normal bathing routine, and you may be like, why don't I shower them every day? Because we can compromise their skin.
Right.
It's not necessary. Okay. They're not you. You're young, vivacious, and everything's intact. They're compromised, meaning their body may not be in a state of what? Homeostasis. Okay.
Homeostasis.
Homeostasis, right? Okay. And
Homeostasis.
so that is why at the bottom of 83, we should make sure that we're observing for all of these signs of injury. Pale white, red, and the purple areas. We talk about our checks and changes. If you're not checking your residents, those safety rounds, remember? If you're not doing those safety rounds enough, you're not going to notice the changes in your resident skin.
Right.
You're not going to notice. And that's really you being negligent if you're not doing these things regularly. Okay, as regularly as often as the policy states in the institution you work for. Okay, swelling, broken skin, cuts and boils, fluid draining from the skin, all of those things are signs that something is out of whack. Okay, so let's look on page 84.
Yeah.
And so hold on. So that was hold on. Let me just make sure I said everything I wanted to say about that. Um, so I'm going to give you some examples and some strategies for how the CNA can support the integumentary system, which is our skin. Um, the 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 CNA repositions immobile residents regularly. The CNA keeps skin clean and dry. Remember those three things: clean, dry, and intact. Very important. Don't
Mhm.
document it that's what you found if you haven't looked at it. Don't document clean, dry, and intact if
Okay.
you have not observed it with your eyes, seen it for yourself. That's part of your checks and your changes. And another care strategy is the CNA can apply moisturizer to prevent dryness. This will all be in your care plan, okay?
All right.
Um, Also a thing that the skin does, it produces vitamin D when exposed to sunlight. Did you know that your skin produces vitamin D?
I may knew something like that around them lines.
I honestly didn't realize it was the skin that was doing it. I thought it was some internal organ that was doing it.
Man,
Um,
seeing
all right. And
All right.
so let's just talk a little bit about some of these skin conditions, pressure ulcers. All right. What's a care strategy that the CNA can do? Reposition the resident every 2 hours. Use pressure relieving devices such as cushions or mattresses. And of course, keep the skin clean and dry.
All right.
Okay. You also, what about skin tears? What if the patient did have a tear in their skin? Here's a care strategy. You handle the resident gently during transfers, and you avoid adhesive bandages or non-stick dressings. Okay? These are care strategies for different types of skin conditions. What about eczema and dermatitis? You want to pay attention to harsh chemicals or even really hot water, right?
Mm-hmm.
If your resident has dermatitis, then hot water dries your skin out even more. All right. Um, the CNA's role is to observe and do what? Report.
Report.
Observe and report. Okay. Observe and report. If you really haven't observed it because you just faking documentation, you're going to be in trouble one day. It's
Right.
going to catch up to you one day. I promise you. Okay. So don't be that CNA, and definitely don't be that CNA talking about you learned from us. Okay. So, okay. Okay. So, because I got it right here in lecture that I told you, I got it recorded. Okay. So that's the integumentary system, which is the same as skin. Okay. If they say on that question integumentary, you better know it's skin. They
All right.
might not say skin
All right.
because we have a whole new language in healthcare. All right. So let's move on to the musculoskeletal system.
All right.
On page 84, it says that it's the muscles, the bones, the ligaments. It gives the body its shape and structure and work together to move the body. Okay. Your bones also protect your organs. And like this, for example, the skull protects the brain. Okay. We have about 206 bones in our body that aid movement and protects our organs. Now, when they say a body in motion stays in motion, when I tell you at this nice ripe age that I am now, I am a testament to that, meaning I've never been one to go get up and exercise, and now I'm paying for it as I move through this phase of my life, right? So inactivity at the top of page 84, inactivity and immobility can result in a loss of self-esteem. I don't have a loss of self-esteem, but depression, pneumonia, and urinary tract infections. So we're talking about the elderly now. And so inactivity and will affect how your bones become accustomed to moving and your muscle systems. And so if you're not active, your body's going to remember that. And when you try to become active, it's not going to be comfortable.
Ooh.
So say it again.
I said, ooh.
Man, when I tell you, I feel it, right now going through menopause, you guys. Everybody, when you're in a nursing home and a majority of your population are elderly people, they have all the women there have probably gone through this phase of life, but it really takes a toll on your muscles and your bones. And so what I'm doing now is lifting weights. And this is why it's important for you to keep these residents as mobile as possible, to get them up. You're doing them a disservice if they lay in that bed all day, every day, and they have the ability to get up. Now, I know that we have some staffing shortages and things of that sort, but you guys got to do your best. And I always say to students, think about if it was your loved one.
All right.
Would you go that extra mile? And would you want someone to go that extra mile for yours, right? And so this is why it's important. So inactivity, it leads to constipation, blood clots, dulling of the senses, and muscle atrophy. What does atrophy mean? What does what does it mean right here on page 84?
It says it says they also gonna leak concentrated blood clot adolescents and muscle. Uh, uh, or
The
ooh,
muscle wastes away. See it at the top of 84? You got your book out?
oh yeah, when atrophy occurs, the muscle wastes away,
The muscle wastes away,
decreasing
decreases in size, and becomes weak. So if you're laying, you can be right now just as strong as an ox right now, sir. But let you lay in a bed for 20 days. I don't know how long it takes before muscle atrophies. So I'm giving an example. If you lay in that bed for 20 days, your muscles will lose mass. And when it's time for you to try to stand up, it'll be hard for you to stand up because you don't have those muscles supporting those bones like they were 20 days prior. Okay.
right,
Another thing that happens is contracture. You're going to see residents that have contractures. And that's when a muscle or a tendon shortens and becomes inflexible and freezes almost. Okay. And when it is hard, so you see me right here doing this, when you have to try to open this up or get this to move, it has stiffened in place and
mm,
you cannot move that arm. You cannot open that arm up because it has contracted. Okay. So that is a common situation to come across in the elderly. And this is why it's so important that we do range of motion exercises, which we will be doing tomorrow in class. And range of motion help exercises help prevent these conditions. Okay. So if you say you don't have time to help this person extend their arm and abduct and adduct, abduct and adduct. Did you read about that yet?
yeah, yeah,
Yep, very good. Yep.
yeah, yeah,
So see, and so you see how that may not have been a term that you knew, but now that you've read, especially ahead of the class, right?
right,
Now you know what I'm talking about in lecture, right? That's why it's so important to read because by the time I get to speaking about it now, it could be your second time hearing this information. And
right,
remember, the best way that we learn is to put our eyes on this information over and over and over again, right?
right,
So this is the second time you've heard these terms, second or third time. Abduct, adduct, okay?
right.
And
And
so
abduction is away, and adduction is to bring back.
yes, there you go. There you go. You better tell me something, right? Okay. See why I can't record. Right? So, so how look at page 84. It says now how the nursing assistant can help. Falls can cause life-threatening complications. Remember that?
Right,
And we can prevent falls by answering call lights immediately. All right. And so residents should wear non-skid shoes that are securely fastened, right? So we're just talking about if these residents have compromised musculoskeletal systems, have situations and issues such as atrophy and contracture, we can help by restricting the movement without you being present, making sure that they have their call light. This is why a call light is safety. Okay. We only want them, if they have these conditions, we only want them moving in our presence and under our safety. Okay.
okay,
Over on page 85, it talks about arthritis. Arthritis equals, it refers to inflammation. You need to understand that. Inflammation. Arthritis is inflammation. Anytime they say, oh, I got an arthritic elbow, you got inflammation in there. Oh, I got
okay,
arthritis in my back. There's inflammation there. Okay. It means swelling. All right. Swelling of the joints. Okay. So, arthritis is it's an autoimmune illness. Anytime you have inflammation, it's usually triggered by your immune system. Okay. So you can read on. I'm not gonna read through this. You need to read about rheumatoid arthritis, osteoarthritis, and
okay.
just kind of understand the points that the book is making to those, just so you might understand the difference between the two. Okay.
All right,
Now, one thing that I do in class is when I give you questions, that are not direct questions. I give you questions that make you let me know that you understand the concept. Almost like roundabout questions. I'm not going to ask you something directly because the state exam is not going to ask you something directly. They want you to understand concepts, and that's the best way to learn, because once you understand concepts, you'll never lose it, right? Okay. And
Right.
so over on page 85, at the top up under guidelines, it
Right.
says, watch for stomach irritation or heartburn caused by aspirin, ibuprofen, or other arthritis medication. Okay? So
All
now,
right.
if you had a question that asked you something like, the patient, you came into the room and your resident complained of stomach irritation and heartburn. The resident may have a diagnosis of
That's, are you
uh
oh,
hold on, I'm finna say some crazy stuff. May have a diagnosis of head no, no, not headache. Um dang, Felicia, let's see. Diabetes, okay?
all
Uh
right.
asthma, um COPD, arthritis. Do you see?
Yep.
Why would the answer be arthritis?
You said why wouldn't it be?
Why would it be arthritis? It would be arthritis because we know that,
It refers to inflammation, right?
yeah, if the patient has arthritis, it's inflammation, and
Right.
we use ibuprofen and aspirin to treat inflammation. Do you see what I'm saying? We don't use ibuprofen and aspirin to treat asthma. So they want you to correlate
Mm,
arthritis with inflammation and these medications, anti-inflammatory medications. Do you see what I'm saying?
I got you. I
It
see.
helps. See how it's not a direct question, but it
Right.
it it, it lets the tester know, okay, he understands that arthritis is really inflammation, and anti-inflammatory medications like that resident might be taking anti-inflammatory medications regularly, which has caused them to have stomach irritation and heartburn, right?
Okay.
That's what I mean about
Mm.
understanding, conceptualizing your understanding. That goes a little deep. That's some nursing stuff.
Oh, it is.
Do you hear what I'm saying?
Yeah. Yeah.
Right? And so when you hear CNA, something, the nurse don't do nothing. The
Mhm.
nurse does this deep thinking like this. Okay? When you become a nurse, you'll do this deep thinking, right?
Right.
Okay? Because that's what they have to, that's called critical thinking. Critical thinking. This right here. Okay. So now we go down. Let's see. Look on page 86, and we talk about what I just mentioned about the word menopause. See it in
Yeah.
bold right there?
Uh,
Menopause, when a woman loses her estrogen, when her estrogen levels decline, man, oh man, your body and your bones feel it, okay? And so you're dealing with an elderly population. They also have the symptoms of menopause going on in their bodies, okay?
all
And
right.
so what does it say? Exercise can strengthen bones as well as muscles. So your range of motion exercises is helping these your residents with signs and symptoms of menopause. Do you see the correlation there?
Sorry.
You understand the correlation?
Can you say one more time? Sorry.
So when you do your range of motion
All
exercises,
right.
okay, and get them up out of the bed into the wheelchair or up out of the bed into a cardiac chair. These things strengthen bones as well
Okay.
as
Yeah.
muscles. So
Right.
you see the correlation between your range of motion exercises with bone strengthening as a result of maybe menopause. You see the correlation with all
Yep.
of that? Very good. Okay. So they talk about hip replacement, and over on page 86, they talk about partial weight bearing, non-weight bearing, full weight bearing. If you're asked a question about any of them, you need to understand those definitions and how to describe them. Okay.
Right.
Now, up at the top of 87, I have highlighted never perform range of motion exercises on the operative extension. It says leg up there unless directed by the nurse, okay? So,
Right.
because we were talking about weight bearing. So whether or not a person can stand on hold their whole body or not, okay? So it says never perform range of motion exercises on the operative leg unless directed by the nurse. So if you have someone, remember that there's rehab also inside of these facilities.
Right.
So
Okay.
you got some people, you could have someone your age, Cairo, that is in there and just going through rehab. And now you'll have to come in and maybe do range of motion exercises on them once they come out of rehab and go back to the residential side, right? That's when you continue doing what the physical therapist was doing in rehab. Now you're continuing it by doing your range of motion exercises, but you will never do range of motion exercises on the leg that was operated on
Okay.
until you without an order. Okay.
Gotcha. Makes sense.
Okay. Right. And so now let's see. Here's some, let me see if I can see a few things. Okay. So here's some common conditions of the musculoskeletal system. We talked about arthritis, osteoarthritis, and rheumatoid arthritis. So what are some of your care strategies as a nursing assistant? You might be apply heat or cold as directed. Okay. You'll assist the resident with joint supportive devices such as braces. You'll encourage low impact exercises to maintain mobility. Okay. With osteoporosis, um, it says here in, let me see, osteoporosis. Hold on.
Condition with bone and lose density.
Oh, what is it? What does it say?
It's a condition in which bones lose density.
Very good. So when you have someone with osteoporosis, here's some of your care strategies. You want to prevent falls because they will break easily. Okay. So you want to prevent falls by keeping pathways clear. Remember when we talked about coming into that room and leaving it as you found it,
Yeah.
not changing up things in their room for them, right? And so that this is a care strategy, keeping pathways clear, keeping things where they know it was, providing calcium rich foods to support the bone health. That's why you got to know that dietary card, right?
Right.
So you don't want to just be feeding Miss Jones stuff that's not calcium rich because you've picked up the wrong tray, right? Miss Jones specifically needs calcium rich diet for her osteoporosis, right? So that is why that dietary card is a patient identifier, remember?
Right.
Okay. And then here's another care strategy for osteoporosis. Assist with safe transfers and mobility aids. All right. This is not hard stuff. This is just reiterating your role, right? Everything you do is so important as a nursing assistant. Okay. Now let's talk about fractures. What about fractures when actually a bone breaks? Here's your care strategies as a nursing assistant. Follow the doggone care plan, right? For immobilization or cast, right? Report signs of infection such as redness or swelling, and monitoring for pain and assist with proper positioning. That's why every time you exit that room, you want to ask them, is there anything else I can do for you? Right? Are you
Right.
comfortable? Every time you're moving them, are you okay? Does this hurt? Are you comfortable? Okay. Right? Monitor. That's you monitoring for pain and asking those extra probing questions. Okay. And for contractures, we use range of motion exercises and splints. Okay. So the nursing assistant has a broad range of activities and responsibilities when it comes to the musculoskeletal system. And I don't think when sometimes when we're out there working, we don't see it like this. We don't see it like this. We just think, oh, I got to move her. No, it
Right.
goes deeper than that. Okay. All right. And so let's go on over to the nervous system. The nervous system.
Yep. Yep. Yep.
Now, let me tell you how the hairs on your body is an extension of your nervous system. Did you know that? Think about
It's,
it. The hairs on your body. Think
no,
about this. Have
wait,
you ever heard of someone say the hairs on her arm stood up,
yeah, yeah.
right? From fear, right? When you're scared. So that's how I'm telling you, this is how masterfully our bodies are made. I love talking about the body because it's really a genius piece of art, right? It's like genius. So the nervous system, don't take it for granted. Every time we interact with our environment, we're engaging our nervous system. Okay. And so and it's the system, page 88, that controls,
Hmm.
it's the control and message system of the body, right? So you have the CNS, which is the central nervous system, and the PNS, which is the peripheral nervous system. When I first started looking in this book, I was like, wow, they going deep in here. But if it's in this book, apparently they want a nursing assistant to know it. Okay.
Right.
So don't sleep on this information, and it's nothing but to read, right?
I already got that done.
So read through these, right? The central nervous system is our messaging system, right? So now we get into these um uh things that come from a compromised central nervous system. And the first one, and the very prominent one, is CVA or stroke.
Yep.
Okay. We learned about that in the first week. All right. And we know that it's cerebral vascular accident. Okay. And we call it sometimes a brain attack. All right. And so we went through this before. After it says down here on page 89, after a stroke, a resident may experience paralysis, has a name for it. What's the word on page 89? Paralysis.
Uh, uh, hemiplegia.
Yep, hemiplegia. Yep.
Hemiplegia.
And then weakness on one side of the body is called hemiparesis,
Yeah.
right? These
Braces.
are these are, I always say these are, it's a whole new language in the healthcare field. And I'm not saying it's an easy language, but they all make sense, they all make sense, right? So and then we've already went through these earlier last week. And so read through this again. You should already have um highlights. And so now you should just be reading, hitting your highlights.
Right.
Okay. All right. And so read through that and just go back over that. We went carefully over CVA and stroke um
Yep. Yep. So,
last week, right? All right. And so remember, we talked about never referring to the weak side as the bad side.
yep.
We refer to it as the involved side. Okay, that's dignity, right? And respect. Okay. All right. So people with a CVA or stroke will be confused or have memory loss, and it can be upsetting. And so we have to be patient with them. Okay. And
Right.
we always want to encourage independence. So you can read through this because this is reiterating in another chapter from what we've already talked about. But as you have started your skills training, look down on the bottom of page 90 on the right-hand side, that last final paragraph on page 90, right? And it talks about dressing from the weaker side first,
Right.
right? And I think you've already done that skill and mastered it.
Yep.
Okay. And so these are people that have had CVAs or strokes, or in other words, brain attacks, right? Okay.
Right.
And so you see how everything's coming together, why
Yeah.
we do things, right? This is, yeah, it's coming together. Even in the short term that this program is, that's why this reading is so important. And this is why lecture is so important too, right? It helps you put to understanding what you're doing. People, everybody want to do. Remember, we talked about that. Everybody ready to touch, 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 touch. I'm hands on. I'm hands on. I'm hands on. You need to understand the theory behind it. Okay.
Right.
So now it's all really coming together. Remember, we talked about communication and communication. Look on the top of page 91. Now we're bringing it all back. Now it's coming to full fruition where they say keep questions and directions simple for these
Yep.
people that have undergone a CVA. So you ask them yes or no questions. Like, for example, when helping a resident with eating, ask, would you like to start with a drink or milk? You don't say, what would you like?
Right.
Okay, right? Because sometimes they can't express themselves. Turn back to page 89, at the top of 89, because they have trouble communicating and they may have expressive aphasia,
Okay.
right? So that is why you focusing on simple yes or no questions to them to support these residents, okay? All right, now look down at the bottom of page 91.
Right.
Residents' rights, speech impairment. It says nursing assistants should never talk about residents as if they were not there. Even if residents cannot speak, it does not mean they cannot hear.
Yep.
Okay? Just a note for you. All right. Now let's look at the top of page 92, Parkinson's disease. Now, when you're learning, the book gives you certain information that you should really pay attention to. So up under Parkinson's disease, you see the word gait highlighted. We know
Right.
gait means what now?
Walk. Walk.
Right. Okay. So how does a person with Parkinson's disease walk? What does it say right before in the same sentence with gait? What does it say?
It's stooped, posture, and shuffling.
Very good. Yep. And so if you were given a question that said your resident has stoop posture and shuffling, what condition might your resident have?
Parkinson.
Asthma,
Oh,
osteoporosis, arthritis. No, 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 I'm not gonna make it that simple. Asthma, osteoporosis, CVA, or Parkinson's disease.
Parkinson's.
Right. Now, isn't Parkinson's disease up under
Oh,
CVA?
oh. Yep, it sure is.
Do you see? So which was the best answer? Do you understand?
CVA
No,
is
no, no. You're
up under.
correct with Parkinson's. But
But
that's that trick question when we say answer the best answer. So
okay.
Parkinson's is up under
It's under CVA stroke.
yeah, it's up under CVA. Uh, is it? Hold on for a second. Am I
Yeah,
saying that right? Hold on, hold on, hold on, hold on, hold on, hold on, hold on. Nope, nope, nope. No, it's not. I'm sorry. It's not up under CVA stroke. I'm sorry. I'm sorry.
that's his.
I stand, I stand.
Oh, I thought it was.
Nope, nope, nope. It's highlighted. I'm sorry. I missed the highlight. So nope, it's at the top of page 92. It's a whole different condition. I'm sorry. So Parkinson's is correct. Okay. But but you see that we're talking about what it's up under is neuromuscular, I mean the nervous system conditions, right? And so
Oh,
Parkinson's is correct, but you would have to know that Parkinson's is described as stooped posture and a shuffling gait. Okay.
right.
Right. So you would only know that if you're reading and studying. Okay. So if you're shuffling along and not picking your feet up carefully, you are at a high risk for falls. It says right down there up under guidelines for Parkinson's. You're at a high risk for falls. Okay. And so they might ask you a question that says, your resident has Parkinson's. The resident is at risk for, and falls might be under there, but they'll give you a another list of things, right? You need to
Right.
understand that shuffling and that compromised gait and that stooped posture causes them to have that high risk for falls, okay?
All right.
All right. So you see they go through multiple sclerosis, they go to head and spinal cord injuries. And over on 93, you need to know what paraplegia means. Para is two, means loss of function on two parts, like lower body and legs. And quadriplegia means loss of function in legs, trunk, and arms. Okay.
Okay.
With all of these nervous conditions, safety is very important. Okay. And we have to make sure that we're always alert and responsive to them so that they don't try to do things themselves. This is why you should be checking on them constantly.
Right.
Okay. On 93,
So you
excuse
said
me,
para means two, right?
para means two, yes. And
Okay.
quad is four,
Right.
right? Yep. So these are those prefixes that you'll see used on over and over again, but they'll be describing something else, right?
Gotcha.
Okay. So the nervous system, sense organs. So what are your sense organs down there on the bottom of page 93? The eyes, ears, nose, tongue, and skin are your body's sense organs, and they're a part of the nervous system, okay? so so when we start over on page 94, when we have people with vision impairment, remember we talked about, we went through this vision impairment, um you want to uh make sure that you're handling the resident properly, right? You want to
Right.
make sure that you know that they have eyeglasses, and that you want to keep them clean. Their hearing aids, when you're so when we think about the nervous system, uh think about the small things, the everyday small things like putting on their hearing aids helps to improve their nervous system compromises. Okay.
All
So
right.
hearing aids should be worn and kept clean. That's neglect. That's like abuse if a person has hearing aids and you don't put them on.
Right.
Okay. And so when you're talking to them, you should be facing them. I'm down here on page 94 in that orange box, right?
Yep.
Make sure, so these are the ways that the nursing assistant can help the patient from a standpoint of improving their nervous system conditions and helping them with their nervous system conditions. Okay. Um, I'm going to, let's see. Uh, yep. You got Alzheimer's, Parkinson's, CVA, and a nurse and a CNA's care strategies are a lot of, in helping them with light physical activity, um, um, preventing falls, um, assisting with mobility and transfers. These are the CNA's role. Okay.
All right.
Let's see. A CNA, here's a case study example. Scenario: a resident with Parkinson's disease struggles to eat independently due to tremors. So Parkinson's, another symptom that comes through Parkinson's is tremors. Okay. CNA actions. The CNA offers adaptive utensils to improve grip, assist the resident with eating while encouraging independence, monitor for choking or signs of fatigue during meals. Okay.
Yep.
So you'll be doing your skills check off for feeding a resident in clinical.
Okay.
Okay. And if your resident you should see signs that their hands are not stable and they're like this, then you know that there's a care strategy that it's time for you to introduce, which is making sure that they have the proper feeding utensil. And then also being patient and being encouraging, right? And so while they're doing this, yeah, it might, guess what? It might get a little messy while they're doing this, right? But then you just help them handle it because the more that they can do it, they feel independent. It improves their self-esteem, right?
Right.
And it helps with their mobility, right?
Right.
There you go. It's all wrapped up in one. Okay, and so now let's move on to the circulatory system. It's 9 o'clock. Want to take a let's take a 5 minute break, okay?
Five. Okay.
All right. Maybe 10. Let's take a 10 minute break.
Yeah. Okay.
Yes, I'm gonna get some tea.
So how does it work? Do I leave and come back?
Oh, look. I guess you could just turn like your video and your
Oh.
audio off.
Okay. All right.
Yeah, let's do 5 minutes because I am recording.
Okay.
All right. So now we move on to the circulatory system and related conditions. You can find it in your textbook on page 94 at the bottom. And it says the circulatory system is made up of the heart, blood vessels, and the blood. And this is the system that supplies the food, oxygen, and hormones to your cells. Okay, and so that tells you that what you eat goes to your cells. It breaks down and it feeds your cells. So a resident's diet is very important to their cellular function. It also removes waste products from the cells and helps control body temperature.
Yep.
So when we talk about mobility, we talk about circulation, right? So mobility is directly related to circulation, and these things all tie together. Down at page on 95 at the bottom in the orange box, how does the nursing assistant come into play in certain circulatory conditions? Movement and exercise should be encouraged.
Yep.
Okay. So once again, it's not as simple as, oh, I got to get her up to the chair. You are improving circulation. You are improving the nervous system. You are all, when you get that person up and actually do your job, you are doing more than simply getting the person up to the chair. There's so
Yep.
many other things that come into play here. Okay. Walking, stretching, and even lifting weights can help maintain strength and promote circulation. And of course, range of motion exercises. Have you ever seen older people wear it in a coat on in the summertime? Have you ever seen them wear a lot of clothes in the summertime?
Oh yeah, yeah. Also like long sleeves.
Yeah, and
Yeah.
it's because they have compromised circulation and you know the circulatory system helps to control their body temperature. So a lot of them are cold, right? And so you got to think about that when you come into a room, how you may feel versus how your resident may feel, right? So layering their clothes helps to keep them warm. So, they may need more than just a warm blanket. They may need a t-shirt and their pajamas on over top of their t-shirt and their socks and the heavy blanket, right? Okay.
Right.
So just think about that. Their body temperature is not the same as yours. So we all know what high blood pressure is. We've heard of high blood pressure, and the medical term is hypertension. Hyper means elevated.
Yep.
Tension in the body. Tension in the body. Um, this circulatory system is a closed system under pressure. You ever seen someone in a movie get stabbed in the neck and how it starts squirting out?
Yep.
That's because the pressure has been released. The pressure is like somebody opened the pressure valve, right? And that's why they die. They bleed out because their pressure drops, right? So Anytime you open up this system, the circulatory system, you lose pressure. That's why you can die because your blood pressure drops, okay? Now, hypertension predominant in some communities more than others, predominant in the African American community. It can lead to serious problems such as CVA, heart attack, kidney disease, or blindness. Okay. And so you'll see a lot of residents with these conditions from long years and years of high blood pressure. Okay. The heart can only work so much up under that pressure for so long. And when you restrict pressure, when you do have high pressure, it restricts the flow of oxygen. What do we say is in this blood? Food, oxygen, and hormones. It restricts those um, things from going to certain areas, certain organs. So that's why you end up with kidney disease because of low flow of blood and things there, right? That's why you end up with blindness, from the kidney disease, right? Or from the let's say diabetes, right? So we have to pay attention to these disorders. So hypertension is a condition of the circulatory system. You understand that?
Yep.
It's also coronary artery disease on page 96. Now you got a word down there in bold that is correlating to coronary artery disease. What is it?
Gina.
Yes, it's the I actually is long angina.
Oh,
Okay.
okay. Angina. Okay.
Yep. And so it says the heart muscle that is not getting enough oxygen causes chest pain, pressure, or discomfort called angina. Now, a pain of angina is usually described as pressure or tightness. Okay. So we have to you said some people may feel it moving down their left arm or the neck or the left side of the jaw. All right. And over on page 96, what do? When someone presents with angina, they encourage them to rest. And the goal is to relax the walls. So they give them what's called a nitroglycerin, a small tablet. Okay. So when you think of coronary artery disease, you should think of angina, you should know what it is, and you should think of nitroglycerin.
Yeah.
Okay?
Yeah.
And if asked what is the best solution, or what is one of the solution or the most extremely important solution? If they say nitroglycerin versus rest, which one? Look at page 96 under
Yep.
guidelines.
You say rest is extremely important.
Right. So if your question asks you, which is the most important, nitroglycerin or rest, what would they say? What would you say based just off of this reading?
I would say encourage resistant rest.
Yeah,
I
because it
think
says rest is extremely important.
right.
And so we know that the nitroglycerin
It's
is
in,
is ultimately important also,
right.
but sometimes you're going to get a question where they ask you, which one is extremely important? And you
Yeah.
saw that right in your reading, right?
Yeah.
And so that's what I mean about you process of elimination. You like, okay, I know those other two ain't right. Now, which one from my reading did they say rest is extremely important because it helps blood flow return to normal often within 3 to 15 minutes. Now, let's see what they say about nitroglycerin. It says medication is also needed to relax the walls of the coronary arteries. This allows them to open and get more blood to the heart. This medication, nitroglycerin, is a small tablet that the resident places under the tongue.
Mm.
Okay. All right. Um, and it also comes in a patch form down there at the bottom. Okay. So these are two solutions to angina, but they really point out rest first.
Right.
Okay.
Yeah.
And then nitroglycerin is a medication that is always used, very important, but this is an example of knowing that you've read. Okay. Now, here's another condition of under um circulatory system and related conditions is myocardial infarction, MI, or heart attack.
Okay.
Okay? Um, so under these conditions, we've already heard hypertension, coronary artery disease, which is associated with angina,
All right.
and then MI, which is a heart attack. When blood flow to the heart muscle is blocked, oxygen and nutrients fail to reach the cells in that area. That is called a heart attack, okay, or MI. And that's damage to your heart, okay?
Gotcha.
All right. Over here, another condition, you're going to read through all of this.
Okay.
Another condition is congestive heart failure. It's when the left side of the heart is affected, blood backs up into the lungs. It's when the left side of the heart is affected and blood backs up into the lungs. When the right side of the heart is affected, blood backs up into the legs, feet, or abdomen. So you will have left-sided compromise or right-sided compromise. Okay? When one or both sides of the heart stop pumping blood properly, it's called congestive heart failure. You know
Mm.
how when you're on the expressway and it's an accident and everybody slows down to look over at the accident, it becomes
Yeah.
congested.
Okay. Yeah.
That's what congestive heart failure is. It's a slowing down of the blood flow on
Gotcha.
one side of the heart. And it shows up as symptoms very different if it's one side of the heart. If it's the left side, it backs up into the lungs. If it's the right side, you're going to see swelling of feet, swelling of, what do we say? Swelling of feet, swelling of abdomen, and swelling of legs. Okay. All
Legs,
right.
feet, and abdomen.
Yep. Congestive heart failure. But it can be treated and controlled with medication and with, diet and a lot of different things. Okay. So you read through that. And then the last condition of the circulatory system that the book mentions is on page 98, which is peripheral vascular disease, PVD. Okay. And this is when the legs, feet, arms, or hands do not have enough blood circulation. Peripheral
Mm-hmm.
means extremities. Okay.
Okay.
Peripheral means your extremities, means your hands, your feet, your arms. Those are in the middle part of your body. That's your trunk of your body. So peripheral means all the extensions outside of the trunk of your body. Okay. So
All
you
right.
read about that. Now let's see what does the nursing assistant let's see what it says here. What can the nurse let's get some care strategies, for example. All right, so high blood pressure. Um, they call it the silent killer, right?
The silent killer.
High blood pressure, yep, it's because it's asymptomatic, meaning you won't know, you won't have any symptoms,
Mm. Okay.
right? And and because your blood pressure's been high for so long, it shuts down blood flow to very important parts of your body. So now listen to this. And I said that it's a condition that is rampant in the Black community. Okay. Um uh I believe also because of the uh soy, some Asians have hypertension also. I think they balance it out with they drink a lot of tea. But this is this cultural competency that we have to know as caregivers. We got to understand different communities and cultures, right? And
Right.
so, but they eat a lot of soy sauce, which is very can be very salty and cause hypertension. And so I got to read up on that a little bit, but there's reasons for different cultures and groups of people that they have certain conditions and why, right? Osteoporosis runs rampant with Caucasian women. I don't know why, but it's just a fact. It's a statistic, okay? And so they're at greater risk of osteoporosis as they age. has to do something with their bone density makeup. Okay. And so hypertension is one of those things that plague the Black community. All right. And so it's often asymptomatic. And so here is a good correlation for you. Um, so it could be caused from, they say, genetics, diet. We eat pork. Pork is very has high salt content,
Yeah.
right? Um, so let's just say it's from diet and uh genetics. So
Diet.
so let's just say you have hypertension, Cairo, and you're a 26-year-old Black male, and you don't have any symptoms of it right now. You don't know it, and you're not checking your blood pressure, and you're continuing with your normal cultural diet, okay?
Yep.
And adding in that you're being young, you're drinking, and alcohol raises your blood pressure, right? So you don't even know that your body is in a state of outside of homeostasis.
Okay.
Okay. And then what happens is you finally go to the doctor and they tell you, okay, and there's other things that you can do from a homeopathic advantage. But you go to the doctor, Western medicine tells you, here, take this pill. Okay. So you take that pill, and the pill works to relax your blood vessels. We want to open them up so that blood can flow better, right?
All right.
But guess what that relaxation from that medication does to the male? It prevents them from having an erection.
Oh, okay.
It interferes with their erection. So
Gotcha. Buff.
Black men won't take the medicine. Do you
Yeah.
see? So this is why then we have so many Black men go into kidney failure and end up on
Mm.
dialysis. Okay, and it's studies done on this. It's not like me guessing or whatever. I read, right? And so that's why some education is so important in certain communities to explain this. So, if somebody has said to Kyra at 26, if you don't stop that smoking, and if you don't stop that drinking, you already are genetically imposed to hypertension,
All
and
right.
you already, eat a certain way. Why don't you get rid of cigarettes, get rid of the alcohol to
Mm-hmm.
prevent you from eventually having to go on a medication that's going to affect your sex life?
All right.
Then it might be received differently. Do you see what I'm saying?
All right.
You might say, okay, now I got to give up one of these things, right? But that's not how it happens, and that's why it's important that you have cultural representation in healthcare,
Yeah, I
right?
see.
Do you
All right.
see that? So something coming from you, Cairo, as a nurse, because I know you're going to eventually go on to be a nurse. That information coming from you to another Black male is powerful. And so and likewise in any other community, something coming from an Asian male or woman to another Asian person in their community is powerful. And the white community and the Arab community, and it's all important, but it's also important for us to know a little bit about each community so we can do right by them, so that we
All right.
can serve them well, right? That's called cultural competency. And the language is different. And this is why statistics show that when you have caregivers, Cairo, that look like you and come from where you come from, patient outcomes are better because I can kick it with you
All
and we
right.
like each other. Do you see?
Gotcha. All
Right.
right.
And so that's why it's so important to have you finish this program, become a nursing assistant, and represent the culture that you actually have grown up in and you understand. So now you can convey it to your residents and your patients, right?
Gotcha.
Okay. All right. So that is all circulation. And so let's see a couple examples. All right. So for hypertension, what would the nursing assistant, what's some of the care strategies? They would monitor the blood pressure. Okay. So, you got to know what you're doing. You got to know how to monitor blood pressure properly. You got to be astute to recognize when, oh, is this number accurate? This is a little off from
Right.
all my other readings. Well, I this is the first time I've seen her blood pressure this high. And then you actually follow up and do something about it. Like, let me go and check this again. Let me check it on
Right.
the other side, or let me make sure she was sitting up without her legs crossed, right? And so that's what makes a good caregiver, right? And so you want to monitor the blood pressure, you want to encourage a heart healthy diet and exercise, and you want to report any signs of dizziness or chest pain, okay?
Yep.
With coronary artery disease, the nursing assistant wants to make sure that the residents rested and monitor for chest pain. Heart attack, you want to be alert to the symptoms, right? You want to know, you got to recognize when it's happening. All right? That's a strong one, right? And congestive heart failure. This is when we have this backup, right? So we want to elevate the legs to reduce the swelling. Remember when we talked about earlier in the week when I was like, you want to make sure that the extremity is above the heart, remember? Maybe in the first week, I can't remember exactly
Okay.
what but so yeah, so right. And so I can't remember what we were talking about, but when you have congestive heart failure and they have swelling in their extremities, let's say in their legs, right?
Okay.
You want to make sure that their legs are raised up
Okay. Right.
higher than the heart. Because remember when I took you to the sign and showed you about how the circulation goes up and then goes back down and got to
Yeah.
come back
Yeah.
up to the heart. And that's why when a person has a compromised circulatory system, if they're laying in a bed, elevating their legs helps get that circulation
Yep.
back up to the heart and reduces the work of the heart. Okay.
Right.
All right. And so if they got congestive heart failure, any of these conditions, they need a low sodium diet and you need to just pay attention to shortness of breath. Okay. So these are just some of the things that the nursing assistant pays attention to and engages in with compromised circulatory system. Okay.
All right.
Let's move on to respiratory, one of my favorites. I'm a respiratory therapist. Also, my first love. Okay, so respiratory. So the respiratory system on page 98, the body taking in oxygen and removing carbon dioxide involves breathing, inspiration, and breathing out. Breathing in is called inspiration. Breathing out is called expiration. Okay. Down there at the bottom, the word dyspnea. Down at the bottom it means difficulty breathing. Okay. DYS means difficulty. Okay. Let's talk about some of these conditions. You following me? We on page 98.
Okay. Yeah, I see it.
All right. I was looking at you. I'm like, okay.
Yeah. I'm. All right.
All right. We on the
Oh, I'm
page
thinking.
about at the
I'm
bottom.
sorry. Go ahead.
That's okay. Bottom of 98. One thing that I can see how everything is coming together. I can tell it's coming together for you, right?
Right.
This
So,
is great. This is the great part of learning, right? Slowly but sure, you look up and you be like, dang, I'm a pro at this thing, right? You get it. Like one day you get it, right? Okay. So here we got respiratory. COPD. Do you see that on page 99?
yep. COPD.
COPD. Chronic obstructive pulmonary disease. Chronic means long term, meaning this is a disease that shows up from and is long term, meaning it has been going on for a long time and it's going to stick around for a long time. It's a progressive disease and mostly comes from smoking. Okay.
Okay.
Residents with COPD have trouble breathing. Okay. And it's like I said, it's mostly chronic bronchitis is and COPD are kind of used interchangeably. All right. Um, and emphysema. So it is when you just have uh you have damaged the lowest parts of your lung, which is called the alveoli. Okay,
Okay.
so I just want you to really read up on COPD. The
Okay.
You're going to meet a lot of people with COPD, and what you're going to need to understand is that they breathe better sitting up high. Look on page 100.
Okay. Yep.
They breathe better like that because they have a problem getting the air out of their lungs. Okay? That's what cigarette smoking does. Tomorrow, when we're in class, I'm going to show you the area of the lungs that are most compromised by COPD, okay, and why this happens to them. So you can read the guidelines for COPD. You know
All right.
COPD is a big one. COPD is a big one. They might ask you a lot of questions about COPD.
All
Okay.
right.
So understand it. You need to understand it. Cigarette smoking is prominent and COPD is prominent, just like stroke and CVA is prominent, right? So some of these are more prominent than others. So it's important that we encourage fluids and encourage them to, because they're short of breath, they're tired, they're
Right.
very fatigued, and most of them with COPD might require additional oxygen. Okay. um Tomorrow in class I'll explain a little bit deeper. I don't want to go into it on this recorded line though. Okay.
All right.
So but you'll see people with COPD, um uh and they have difficulty getting the air out. Down at the bottom of page 100, the last G in the sentence, the last G
Yep.
in those words, it says encourage pursed-lipped breathing.
First little booty.
Okay, now because they have problems getting the air out of their lungs. And why is that? It's because they have damaged those alveoli and it no longer it becomes less elastic, those little pockets in the bottom of your lungs. So the air gets trapped. And so
Okay.
COPDers, because the air gets trapped, they end up with what's called a barrel chest. Look at
Girl,
me.
that's
Yep, look at me. It's kind of like it's barrel shaped. And you'll see it kind of, the back is curved and barreled. And it's because the air is trapped in there. Okay. And so when you tell them to purse lip breathe, if they have an exacerbation or they're having a hard day, purse lip breathe, they do this. You encourage them to lean over and you say, breathe with your lips pursed together. And they breathe like this.
okay.
And what that does is it helps the air flow out of the lungs better. Okay.
Okay.
All right. So it's in your book. I probably would have never said that to a CNA, but it's in your book. They want you to know it. Right.
Okay.
Okay. All right. And so read up on that. You see that under respiratory, that's they don't go into a lot up under respiratory, but COPD is a big one. There's a lot of conditions up under respiratory, but these are the ones they want you to focus on, right?
Gotcha. All right.
And it's the main one. So I encourage you to really understand it. Okay. If you have any questions, you ask me.
All right.
Sometimes, let me see, it says over here, yeah, they say that sometimes these residents have poor appetites and they have a great fear of not being able to breathe. You need to understand that about these people. They live with a constant fear of not being able to breathe over on page 99. This can cause them to sit upright. They might sleep with two or three pillows. They want to sit up right at night. Okay. All right. And they may have poor appetites. It's about the third paragraph. Well, you're gonna read through it and you'll see it when you
You're
read
right.
it. Okay. All right. All right. And of course, they may have some confusion. Now remember, look down at the bullet points. COPD may cause these
Okay.
symptoms. Now, this is respiratory, right?
Right.
What does it say? Look at the one, two, three, fourth point down. What does it say?
Pale blue or reddish purple skin. Okay, we
What
was
does
talking about
blue
that.
mean?
Blue means, ooh, we were just talking about this. Ah,
Think about it and ask yourself. I'm not going to tell you, okay? Okay, I'm going to
oh,
tell you. Remember lack of oxygen,
okay, yeah,
right? And so these are
lack of
that's
oxygen.
right. Remember the blue blood versus the red blood in that diagram?
Right, okay.
So they'll have blue skin, might have blue skin for lack of oxygen because of their COPD, okay?
Okay. Lack of
Yeah, they also have, I don't see them. Let me see if they talk about this. I'm gonna tell you I'm just gonna tell you, respiratory is my love. Let me tell you something else they may have. I don't see it. They may have uh well, I have to show it to you. Clubbed fingers. The fingers look different. All right, so we'll move on. All right. So that's a big one in respiratory for respiratory conditions, okay? And so let's see what it says that nursing assistant can uh you should understand about oxygen, okay? COPDers might have a little bit of oxygen. I don't want to go too deep into this, but
Yeah,
I'll tell you just so that in case, just to give you a little bit more information. Okay, you breathe right now off of your carbon dioxide levels. The reason why your body and your lungs are expanding and contracting is in response to your carbon dioxide level. Okay?
okay.
You have to expel carbon dioxide from your body. That is why we breathe, to get rid of, eliminate carbon dioxide. You hear me?
Gotcha.
CO2. That's why we breathe, to eliminate carbon dioxide. All right. People think, oh, we breathe to get oxygen. We're breathing to eliminate carbon dioxide.
Breathing to eliminate
Okay.
carbon.
Yeah. So this is gonna go a little bit. This is a lot, but I'm just sharing it with you because you going one day you might you one day you gonna learn, read something and be like, I remember her talking about this. Okay. Now, when people smoke cigarettes, they damage the ability to move carbon dioxide and oxygen from their bloodstream into their lungs and out of their mouth,
Okay.
right? They damage that process. That's why air gets trapped. Okay? All right. So remember when we said we have body systems and broken down to organs, broken down to
Yep.
cells, right? Tissues and then cells, right? Okay. At a cellular level, we no longer can move carbon dioxide and oxygen like we're supposed to once we have smoked for many, many years. All right.
All right.
So what happens is the carbon dioxide gets trapped. Didn't I say COPDers trap gas and air? Okay.
Yep.
The carbon dioxide gets trapped. So now they have higher levels of carbon dioxide than the normal person, Cairo. So they're breathing no longer off of their carbon dioxide. Now they're breathing off of their oxygen level. Now,
Mm.
listen, why am I saying this? Because you can have a person with COPD who has been holding on to a lot of carbon dioxide in their body.
Move. Right, and they supposed to be okay.
And if you give them too much oxygen, they will stop breathing.
Oh wow.
So that is very deep. That's a very deep understanding.
Yeah, I'm gonna have
But
to.
what I want you to hear in this is when you see somebody with a diagnosis of COPD, you think twice before you go and turn into a cowboy and turn that oxygen up.
Right. Okay.
Okay?
Yeah, I'm
You
gonna have to research
it
on
should trigger you. I don't want you to understand it. I ain't saying like you got to be a master of it. But when
that.
you see COPD and oxygen, you should be asking questions. Is
No,
it
gotcha.
okay to turn him up to 4? Are you sure? Because not all COPDers have this problem, but most of them are what we call CO2 retainers. And you be the one in listening to a nurse that don't know no better. Turn
Hmm.
that patient's oxygen up because they told you to. And now you go back and that patient is dead. Do you hear me?
Gotcha.
This is a deep respiratory concept that a lot of nurses do not understand. Okay. So all I want you to know is to be alert. That's it. Okay.
All right.
All right. Because it's a bad thing when you're taking orders from people and they don't really know.
Right.
Then they done told you to go do it. Just turn that up.
Yeah.
Right. And then you say, okay, are we sure? Is he a CO2? You say something like that, they're gonna be like, who he think he is?
Right.
He think he is he a CO2 retainer? Who do I will think he is? I'm just making sure because I know that oxygen can be toxic to a person with COPD or that retains carbon dioxide.
Right.
They're gonna think you the smartest person in the spot, right? So I don't want you to need to know all that. I just want you to be conscientious of it and alert
Right.
when you see those two things. Okay. All right. And so because guess what you are? Isn't that what you are? The eyes and ears.
5 years.
You're the eyes and ears of healthcare. Okay. All right. So let's say when you got somebody, here's some CNA care strategies. You want to encourage the use of prescribed oxygen devices. Okay. You want to assist with energy conservation techniques during activities of daily living. So you're going to run into a hard time with these people while you're trying to get them to do their ADLs eating because they're fatigued from breathing. You're breathing
Right.
passively right now. You don't even know you're breathing, right?
Gotcha.
They work to breathe.
Right. Yeah. Synced
Okay.
up.
So they're tired simply from breathing, right? And so these are your care strategies, and you want to monitor for signs of distress, right? If they got asthma, you want to identify the things that trigger them. Cairo, when I told you when you came in for orientation, one thing I said was no perfume, no colognes,
Right.
right? We never discussed why. Here we are under
Nah.
asthma.
Yeah, okay.
You can trigger an asthmatic episode in a patient coming in there trying to smell like Rico Suave. Okay.
Right.
So it's not important. Keep your cologne at home. Use it when you go out. Don't bring it into these facilities because it can trigger a person's asthma. So see how we said
I
there's
remember
rules
you
for
telling me.
everything and it's all safety. Don't take it personally, right? Okay.
Right.
So that is why we don't wear perfume and cologne around our residents. Okay.
Yeah.
Um, Pneumonia. What can you do for pneumonia? You want to encourage deep breathing exercises. Have you ever heard of an incentive spirometer?
Nah. No. No.
Okay, it's a device. I have to show it to you. Where it helps a person when they have pneumonia, they breathe in deep, and these balls go up in the air, and then they breathe out. It encourages them to deep breathe. I don't know if we got one in the training center. I gotta make sure I get one, but I'll look and see, and I can show you what an incentive spirometer looks like. So this isn't in your book, but these are. Remember, I told you I have my own specific notes for my our CNA students that I want them to just be familiar with, right? It won't be your first time hearing it, okay?
All right.
All right. And then TB, tuberculosis.
Mm-hmm.
So you got to get your, did you go get your,
Oh, yeah. I went yesterday. He told me to come back Wednesday after 4.
very
So
good, okay? So tuberculosis is a contagious bacterial infection of the lungs. It is highly contagious, okay? And so that's one of those remember we talked about transmission?
yep.
right? And so this is airborne, right? And so this is where you would wear a mask, make sure that they would have the room, a sign up in the room saying, TB precautions, and you want to make sure that you're wearing your proper PPE. But how can you help patients with TB? You want to follow infection control measures. You want to ensure they're adhering to their medication and monitor for worsening symptoms. Okay. And so when you say ensuring that their medications, you're not administering the medications, but you're like, Miss Johnson, did you take your medications today? Okay,
Right.
very good. It's just, um, it's just you can't promote it, the nurse really can, but you want to, as you're talking, you're spending so much time with them, you want
Right.
to be talking to them about, and then you may have a better rapport with the resident. She may say, no, I don't want nothing from her. You may say, Miss Johnson,
Mhm.
you gotta come on now, you
You're
got
right.
to take your blood pressure meds, you gotta take this, right? And they may respond differently to you. Okay. Right. All right. And so now we've moved on and let's go to the urinary system. Okay.
Yeah.
We don't say pee pee, we say urine. Okay. We don't say piss, we say urine. Okay. Right. All right. So urine is important, right? Um, all right. It's important that we eliminate the waste from our body, and that's what our urine does. All right. Through the urine system, we eliminate waste products created by the cells. So when we get down to that cellular activity, those cells are working. They're working, they're doing work. And the byproduct of some of this work is waste products. So
Mhm.
then our body intelligently gets rid of it. Okay. And through our urine system. So we have to make sure that our bladder and our urethras and our ureters are all intact. Okay. And super, super important. Remember the word incontinence?
Incontinence.
Incontinence means if you saw the word, well, it's a word you gotta know. Incontinence means you cannot control your bladder. We talked about this up under infection prevention and how bad urine can is for the skin and in preventing infection, right? And so if
Okay.
you let somebody lay in their urine for hours and hours at a time, it will eventually break down their skin, right? So
Ooh,
so
yeah.
now we're talking about the urinary system. This is why that person is incontinent, meaning they cannot control their bladder. They have no feelings of urgency. When you got to urinate, you feel it, you
Yep.
run to the bathroom. They don't have that. It just flows out. And if you're not checking them every 2 hours, they're sitting in it and it's compromising the largest system in their body, which is their what?
The skin.
The skin, right? See how it all comes
Ooh.
back?
Yeah, and that's crazy. Not to cut you off, I just saw a perfect example of that going around on social media like past couple of days, and it's so sad. I'm like,
What
wow.
was it?
Um, I'm guessing it was. I'm guessing it was a dude and his wife, and he was basically, stopping the family members from seeing their member, the loved one, and whatnot. But it turns out he was neglecting her. He was supposed to be her. He was a CNA. He was supposed to be her caregiver, and he was neglecting her. And I guess he had her, sitting in the urinal all day. Um, and I guess when the family members finally found out what was going on, they took her in, and she has like her shorts were open, like behinds open, feet, everything. They were just bad. I'm like, wow,
Wow.
yeah.
Yeah.
I'm like, okay, so now, and I watched that video, then that kind of referred me back to here.
Yeah, and help you connect. And that's you know what? And I in this day and age, I encourage some watching of videos like YouTube and stuff, or to help you connect the dots, right?
Right,
Not to take everything that you see literally in it, especially when you're learning, because you might see somebody do something the wrong way or whatever, but to help you connect your brain to what you've been reading, right? Connect your eyes through your brain to what you've been reading, right?
right.
And so, Yeah, and it happens. That's real life out here. It's real life out here, right? So so we have urinary incontinence. It's over on page 101
Yep.
in the orange. You see it?
Yep.
Mm-hmm. So you need to understand that word incontinence and what it means and what it implies, okay? And
Gotcha.
when it comes to guidelines for urinary incontinence, okay, it says it's a major, look at number 3, the third guideline. Read what it says.
It's a urinary incontinence is a major risk factor for pressure injuries.
Didn't
Documented
we
by.
already discuss that earlier?
Oh, yep.
Yep.
Yeah.
So because urine is acidic and it just sits and it will destroy your skin if it's just in
Yeah.
contact with your skin all the time. All right. So cleanliness and careful skincare are important. Urine is very in the fourth guideline, urine is very irritating to the skin. It
Yeah.
should be washed off immediately and completely, right?
Yeah.
So here's my thing. You see where it says completely.
Yeah.
If you're charting clean, dry, and intact, and you have not observed it and you have not done it, then you are a liar. And that is, it will catch up with you and you will get in big trouble for leaving a resident in this condition and charting that they were left in a clean, dry, intact condition, their skin.
Right. So like
Okay.
when okay, all right. So when they do check on after they well say never mind. Go ahead. I'm sorry. Let's go ahead.
No, go ahead, please.
All right.
Listen, hold on. I'm finna pause. I'm finna pause. I'm gonna.
Okay.
So when you're talking about perennial care, you're absolutely right. This is why we do perennial care. Peri means around. The anal part is around the anus, right? And so we have the vaginal area around there too. That's a very, very sensitive area, and we got to be very careful to keep it clean. We have two openings there. And when we think about the chain of infection, we talk about the portal of entry and the portal of exit, right?
Right.
And so, um, hold on for a second. We're going to pause. Okay, forget where we were, but let's see. Oh, so we were talking about perennial care. And so actually I think we're going to be going over that some today too. Okay. All right, so that is all right. So over on page 102, and it goes into urinary tract infection, right? And so that's speaking, and you see at the bottom of page 102 a good picture of what I'm talking about, right? Preventing urinary tract infections.
Yeah.
And you can see the proximity of the vagina to the anus, okay? And
Yeah.
so when we do perennial care, it's very important that we follow those steps to prevent transferring the whatever we've cleaned to keep
Yeah.
from reintroducing it. Okay. And so this is perianal. Perianal. If it's hard have a hard time saying perennial, it means perianal. Okay. Around the anal canal. All right. All right, so read up on all of that. All right. You see right here it says preventing UTIs. Encourage residents to wipe from front to back after elimination. Very hard to do unless you start doing it early and it becomes a habit. But and also drinking water. Okay. Um, and then look down here at number the guideline number 4.
Number four.
What does it say?
Let me see. Let's say I'm still on 102, right?
Yes.
Taking showers rather than bath helps.
Oh, no, 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 no. I'm sorry. On 102, where you at? No,
The fourth G.
guideline number 4. You missed it. It's at the bottom on the left side of number of 102. The bottom,
Oh,
right.
okay. Offer a bedpan or a trip to the toilet at least every 2 hours. Answer call lights promptly. Okay.
All right. Yeah. So
That's
You know, you should be offering them. Do you need to go to the restroom? You should, no, no, no. They keep saying no. You should be encouraging it, right? At some, you know they may need to. I know you just went. Do you want to go before I go? Because I might not be back for a couple of hours. Do you want to get up? Right?
bro.
And that's again, here go that call light, right? You got to make sure they have it so that they don't urinate on themselves, right? And so it because when they do, it increases the risk of infection. Okay. That urine goes down into their anal area, sits there, and breaks down skin. All right.
Right.
All right. So there you go. All right. So now let's see some of the care examples that mm, CNA can implement. Some of the care strategy: urinary tract infection, encourage fluids, ensure proper hygiene, wiping front to back for females, and monitor and report symptoms to the nurse promptly. Okay. Incontinence. What does incontinence mean?
Oh, just said that.
Mm-hmm.
Don't say. I got it. Incontinence, man.
If you can't remember, go back in your pages. It's back a couple of pages right there.
You were just talking about
Yep, I was. You
uh,
need to.
it's when they aren't able to use the bathroom.
No, they can use the bathroom.
Well, not use the bathroom,
Read
but
what it says right there in page 101 in that orange box. Read after, what does it say?
the inability to control the bladder.
Right. You can use the bathroom. You can urinate. You just can't control when it happens.
Okay, can
So
control.
me and you sitting in class and you just urinate on yourself. You can't control it.
That's urinary incontinence.
Incontinence. How you gonna remember that? You need to figure out how you gonna remember it. Okay.
Probably yeah.
Maybe you
That's
need to write it down 75 times. I don't know, right?
incontinence. Yep.
Okay. Okay.
That's relative.
So here's your care strategies. Provide a toileting schedule to prevent accidents. Use incontinence products such as pads or briefs. Do we call them diapers?
No.
No, we do not. That's dignity. They're called briefs. Okay. And care strategy is keeping the skin clean and dry and intact to prevent irritations. Okay. And so there's other conditions, but those are the big things that they want you to consider as a nursing assistant. Okay.
All right.
All right. Now let's look over on page 102, and we're going into the gastrointestinal system. That's your stomach and your colon, and there's that word. Remember that word?
Elimination.
Elimination, right?
Uh,
Right? Elimination. What it says is what?
the process of expelling waste.
Very good. Yep. And so let me ask you a question. Here's a trick question. Does your cells use the process of elimination?
Yes.
Yes, because cells, remember we talked about cells, after doing all the work, there's waste products and it gets
Right.
rid of it through your circulatory system.
Right.
See? There you go. That is conceptualization, Cairo. You know what I'm saying? I love it. So, the gastrointestinal system has these functions. This is what your gastrointestinal system is here for: digestion, absorption, and elimination. These are different. You need to understand what they are. Digestion is, what does it say?
The process of preparing food physically and chemically so that they can be absorbed into cells.
So, preparing food. Are they talking about preparing it on the table?
No.
They talking about chewing and breaking it down and your body breaking it down into smaller pieces, components, so that it can
Right.
then it can be absorbed in the gut. Okay, now the absorption is the transfer of nutrients from the intestines to the cells. That's where when we say the food, when we say it's feeding and it's eating, your cells are eating, right? And so it has to be broken down, and then whatever is not in there that's not necessarily, we eliminate it through our bowels,
Right. I'm
our
sorry.
anus. Okay, okay, and so that's that process. It works perfectly. Now, when someone has a gastric bypass surgery. They mess up the absorption process.
Mm.
So I've cut out, they say your intestines are, if you stretch them out, they're the length of a football field.
Oh wow,
Isn't that crazy?
that is crazy.
So they cut out a piece of your intestine. Well, they cut out, I don't know what part they cut out, but when you have gastric bypass, they bypass a piece of your intestine and they cut it out, right? And so that means that you don't have, once it goes through your mouth, down into your stomach, and starts going through it, it doesn't have as long to travel.
Right, slow to
So
digestion.
now it doesn't have as much time for to transfer the nutrients from the intestines to the cells, right?
Right,
Because you've cut down the time. And that's why we have people with gastric bypass, they have malabsorption syndrome. And it really can not be a good thing for them. It really can mess them up, right?
was that on here?
Huh?
You said mild absorb. You just say again?
Malabsorption. Mal means bad. Like, hold on, let me just
Oh,
make.
okay.
Mal means poor. Like, hold on, let me make sure. Mal. Hold on. See exactly what. Hold on. Mal as a prefix. Yeah, bad. Mal means bad, wrong, ill. Okay. So they have a bad absorption now. Okay. They have malabsorption syndrome. They can develop that. All right. And so, how does the nursing assistant assist with the gastrointestinal system and related conditions? Fluids and nutritious, appealing meals should be encouraged. Okay. And you should allow time for them to eat.
Okay, yeah,
Mm-hmm. Right. So now we know what the word incontinence means, right?
yeah.
Urinary incontinence means your bladder don't work and you can't control your urine. What about fecal incontinence on the page of 103? What does fecal
Fecal.
mean?
It's a harsh stool that's stuck in the rectum. It cannot be expelled.
Yep. And so fecal represents feces. Feces. We don't say boo boo. We don't say shit.
Yeah,
We say feces. Right? So fecal incontinence, inability to control the bowels. So that's a bad thing. You can't control your bowels, so you're just having bowel movements all on
mm.
yourself. All right. So that can be caused from many things, right? So if you have a person like that, that's a bad situation because you're constantly changing them.
Right.
That's hard work right there. That's very hard work, okay?
Ooh,
And so then up at the top of 103, another condition is constipation.
patient, huh?
That's when you have the inability to eliminate stool or the infrequent, difficult, and often painful elimination of hard, dry stool. So when you take a lot of ibuprofen, all right. So now remember, listen to this. Here I am. I'm finna test you. This is conceptualizing. If you have a patient that has arthritis, arthritis is related to what? Inflammation.
Inflammation.
Remember that?
Yeah,
Inflammation means swelling in the joints and all that, right?
yeah.
So they're taking ibuprofen for that inflammation. Motrin is an anti-inflammatory. Anti means to go against, okay?
Okay, yeah.
Anti-inflammatories slow down your bowel movements.
Say
Okay?
that one more time.
Anti-inflammatory medication
Okay.
causes constipation. So if you got having a pain, if your girlfriend having cramps every month and she taking a whole bunch of ibuprofen,
Yeah.
she's at risk of having constipation. So if you're taking ibuprofen, anti-inflammatory meds chronically for a chronic condition like arthritis, you might have constipation, right?
All right.
You hear me?
Gotcha.
All right. So we're talking about constipation. Constipation can happen from medication. So if you get a question that asks you anywhere around in here about constipation and a, anti, I mean, a disease state that causes inflammation, you got to understand that they are correlated. So if you say your patient has arthritis and is on anti-inflammatory meds for inflammation in her joints, the nursing assistant should, true or false, make sure to encourage plenty of fluids. True or false?
True.
True, because fluids help with constipation.
Okay. Fluids help with constipation.
Yeah, so think about if you have you ever been backed up and you
Oh,
go,
then protect a bit.
there you go. There you go. Hold on for a second. Let me answer this call. Hold on,
Yeah,
okay?
yeah, yeah. All right.
Put on my Okay, so that's how you tie all these concepts together and understand how one thing impacts the next thing impacts the next thing, right? So yes, if you have a resident that is on anti-inflammatory meds like ibuprofen and Aleve and things of that sort, then you can imagine that they are over time going to develop constipation. So
Okay.
you offering them water and making sure they stay hydrated is not just good for their skin, but it's also good for their gut.
Gotcha.
Right? All right, so that they don't get constipated. All right. And so look down on page 103. You probably heard this from your parents, what the word enema.
Eminem.
See that word enema on page 103?
Yep, yeah, yeah, yeah.
Yep, it's a specific amount of water with or without an additive. Sometimes they put something in the water that is introduced into the colon to eliminate stool. So
Mm,
when you have someone that's constipated, sometimes you might have to give them an enema. We don't want to go through all of this, right? If we can just stay diligent and stay on top of these people, also getting up and moving. You know why when you get up in the morning and a lot of people have a bowel movement first thing in the morning?
yeah.
Yeah, because the movement helps standing upright helps naturally.
Right.
It's gravity. Things start moving. So when people lay in one spot and never get up, it causes problems. Okay. And so one thing you don't want is fecal impaction. Read what
Mm.
that says. Fecal impaction.
It's a hard stool that is stuck in the rectum and cannot be expelled.
And so you
Mm.
have to remove it manually, but you would never do that. It has to be up under only a doctor or a nurse would do this, okay?
Right.
Because your gut, your body, you have uh blood pressure receptors lining your intestines. And
Ooh.
if you remove a lot, have you ever experienced having a bowel movement in your home by yourself and you got lightheaded, mouth got a little cottony? Has that ever happened?
Yeah.
Okay, this is right. And so and do you know so many cold blues happen in the bathroom in hospitals? Because have anybody ever told you you're not really supposed to strain in the bathroom?
Yep, yep. You're not supposed to.
You're not supposed to because it triggers the baroreceptors on your intestine and it drops your blood pressure.
Oh.
So if I have a huge amount of stool stuck in my rectum and it's pulled out immediately, it could trigger those receptors and you can drop your blood pressure.
Ooh.
See what I'm saying? Now, let me say this to you, Kyra. You know how we be talking about when I always say nurses, CNAs, and LPNs of nurse always want to talk about she don't do nothing but
Right.
sit. See that deep understanding?
Yeah.
That's why you go to 2, 3, 4 years of school to understand stuff like that, right?
Right.
So, so fecal impaction is a big thing, all right? And it says here when impaction occurs, a nurse or doctor, not a CNA,
Hmm.
nurse or doctor will insert 1 or 2 gloved fingers into the rectum and break the mass into fragments
Ooh.
so that it can be passed. Sometimes you'll see this in paraplegics, quadriplegics, because they're paralyzed. So when you're paralyzed, guess what else may be paralyzed? Your gut mobility.
Mm.
Do you understand? You see what I'm saying?
Yeah.
It gets deep, right? So plenty of fluids can increase inactivity, all right? And fiber diet, that's why they tell us to eat fiber. Eat an
Okay.
apple,
Right.
eat fiber cereals and things like that. Eat some beans, right? Beans, good for your heart. The more you eat them, the more you fart. You ever heard that?
Oh yeah.
Right, okay,
I
right.
don't even
And
like
so,
beans.
right, and so farting, when you pass gas, that shows that there's movement in your bowels. So it's a good thing, okay?
All right.
All right. So, see, now that you're in healthcare, you could talk about stuff that used to seem, oh, why we talk, but now it's like normal, right?
All right.
Okay. So there's a couple of other things, gastroesophageal reflux disease on 104, but I want you to look at ostomy over at the top of 104.
Yeah.
And that is when somebody has to have surgery and they can no longer eliminate their waste through their rectum, but instead we have to have a surgical creation of an opening from the area inside the body to the outside. Okay? You need to read about this because you will be cleaning these. Some instances, I think CNAs, and depending on where you work, may change these bags. Okay?
Oh,
The
that's
opening is called a stoma. So, let's see. Is there a good picture in here? We got one at the school. Um, I'll try to show you tomorrow, but the opening is called a stoma. Stool or feces are eliminated through the ostomy. You should probably be highlighting this.
oh yeah, it's already highlighted.
Perfect. You already read all this?
Yeah, I was reading it.
Good for you. You was reading ahead.
Yeah.
You're such a good student. You're such a good student.
I was reading this like what last night. So
Very good. And that is so smart to read ahead because now hearing me say it adds further understanding to it.
yeah, yeah.
Right?
Because
Right? And so go ahead.
on the binder it does say for homework review basically the next
Oh, it
chapter.
sure does. Oh, I forgot. We so organized. I don't forget how organized we are. All right, that's right. Right. So you just following the lesson plan, right?
Uh,
And so it says the term colostomy and ileostomy tell what part of the intestine was removed. So there's, the intestine, I told you, they say it is the size of a football field.
right. Ooh.
Different sections have different names.
Ooh.
So if they have to cut into the colostomy, I mean into wait, let me see. The term colostomy refers to the part of the colon that they had to create a hole in, and ileostomy refers to the part of the intestine that they had to put a hole in. You see what I'm saying?
Yep.
Right? So it'll tell you what area of the intestine they had to create the artificial opening in. Okay, and those down there you'll see the bags that are attached, and basically you'll have to empty those bags, and they'll be filled with feces, and it's a very strong foul smell
Mm-hmm.
that you will get used to. Um but it's not inappropriate for you to wear, I believe, a mask to help you to deal with the odor, okay?
You said it is not appropriate.
It is not inappropriate.
Oh, okay.
Now, I don't think it's inappropriate. I think you can wear a mask when you prepare to do this to help with with the smell. Um, but what is not appropriate is making faces.
Yeah, yeah.
Okay, that's not appropriate because it affects their self-esteem. They already have a body image issue because of this. Okay, and you don't want to make it worse. So it says over 105, not all states allow NAs to provide ostomy care. It's facility determined, right? And it
Right.
also says NA should teach proper hand washing to residents with ostomies. So we taught you how to wash your hand properly. You should teach them how to wash their hands properly.
Gotcha.
Okay. And it says in that blue box, residents' rights. They have the right to feel supported. So you should be sensitive and supported. Okay. They have lost a major body function and you should be sensitive to that. And then it goes through caring for it. It's not one of our skills, but you have this book to keep with you as you start your career, right?
Yep.
And you should come back here and reinforce on your own. There's no reason for me to come into any place and you doing something crazy. Okay. You got a whole book. Maybe you weren't trained in detail on it, but they'll train you. You go through orientation and it's your job to do your own reinforcement of your learning.
Right.
You see what I'm saying? This is our individual jobs as professionals, right? Our education is our professional responsibility. All right. So you see, they go right through it here on 105 if you need to ever reinforce. All right. Be that type of learner, be that type of caregiver. You are nursing Detroit.
Yeah.
Okay. All right. So let's see what it says here in my notes about the CNA. Some care strategies. Constipation. Encourage high fiber diet, adequate hydration. Promote physical activity to stimulate bowel movements. Okay. And monitor the bowel movements and report any long absence of stool. So if you come in 4, 5 days and you be like, okay, wait a minute. She hasn't had a bowel movement in 4 days. Let me report this. Right.
Yep.
Okay. Diarrhea, frequent loose or watery stools. What are your care strategies? Provide fluids to prevent dehydration because you know how when you get a stomach bug and you have a bowel movement over and over and over and over again,
Yep.
you get guess what else is coming out? Electrolytes and stuff are coming out in those bowel movements. So you can get dehydrated. Do you know you can have bowel movement so much because there's electrolytes, sodium and potassium and stuff like that in those bowel movements that you just losing all that fluid from your body.
Mm.
Now your heart can go into dysrhythmia because your heart depends on certain electrolytes, sodium, right? So all of this is tied. Your body is
It is.
perfectly wired. It's perfect. So so we got to keep it in a state of what?
Say it again.
We got to keep it in a state of our body in a state of
Oh, I was.
uh,
Oh,
homeostasis.
yeah. That's. I was gonna say the other one.
Don't say the other one. Homeostasis. Okay.
Homeostasis.
Homeostasis. That's what all these body systems are working to create.
Homeostasis.
Homeostasis, meaning even and balanced. All right. Um, yep. And so your role is to observe for the changes, okay, in bowel habits. You hear me? That's your role. Assist with diet and hydration, support bowel health. Do you need to go to the bathroom? Can I bring you the bedpan? Are you sure? Okay. Do you need me to guess what else? Sometimes when a man can't urinate, I was a PACU nurse, and not even a man, but when a person can't urinate, I was a PACU nurse, and when you get anesthesia, it slows down your body, everything, including your bowels. So you can't go home until you until you urinate.
All right. Okay.
So one thing, so we got to make sure everything gets to working back in regular normal homeostasis, right? So we got to wait for them to be able to urinate before we can say, oh, they're good to go home. Well, one of the things that we'll do typically in the bathroom when we take them to the bathroom, because we can say, oh, here's the bedpan. That's not normal. People sometimes need to be in a sitting position or a man in a standing position to urinate. So
Right.
I'll also, so you want to get them up in that position to promote bowel health. And then you also want to, I might turn the water on. When you hear water, it makes you urinate.
Yeah. Yeah.
Do you see? So this is how you support support you know, bowel health. This is how you support urinary, your gastrointestinal system and your urinary system, you know, and that's just one of those little tricks of the trade, right? Turn the water on. If I haven't urinated, I can't, it won't come out and it just might help. It just might help, okay?
All right.
All right. That is the gastrointestinal system, okay? Now here is the endocrine system. Now, this can be a little tricky, like I said. It's hard to understand sometimes these glands and all of that, right? So, describe the endocrine system and related conditions. Um, Glands, hormones. Hormones are carried to the blood. Hormones are carried in the blood to various organs. So, you wouldn't think so we have hormones, we got a lot of hormones. Let's see, so look at the image on page 106.
Yeah.
All of these glands produce hormones.
Okay.
All right, and so let's talk about the biggest endocrine uh condition, diabetes. Let's read about diabetes. Go ahead.
All right.
And it's pronounced diabetes mellitus.
All right. Diabetes mellitus, commonly called diabetes, occurs when the pancreas produces no insulin. I mean, produces no insulin to little insulin or does not properly use insulin.
Okay, so let's read that again and let's pause with these commas so you can really understand what you just read.
Okay. Diabetes mellitus, commonly called diabetes, occurs when a pancreas produces no insulin to little insulin does not properly use insulin.
Okay, so let me tell you something about how one word will keep you from understanding the sentence. Diabetes mellitus, commonly called diabetes, occurs when the pancreas produces no insulin, too little insulin.
Oh, I switched it around, huh?
Yeah, well, you were
Yeah.
pronouncing it like it was T-O too, like T-O.
Oh, okay.
Right. So you was like to little insulin. So right, meaning so diabetes can happen in a wide range of ways. When the pancreas produces no insulin at all,
Hmm.
or it produces too little insulin. There's
All right.
not enough insulin that it produces.
All right.
That's what that means. Or it does not properly use the insulin, right? Okay. So the insulin is the hormone that works to move glucose. This can get a lot. It still gets me a little tripped up sometimes, but I just need you got to read through this and understand that diabetes is caused by a when the pancreas stops working properly,
Okay.
right? And we use insulin to move glucose. Glucose is sugar. You know, we talked about our circulatory system. There's a lot of things in our blood, food, hormones, remember? We shouldn't have a bunch of glucose, sugar in our blood. The insulin is supposed to help with that.
Okay.
The pancreas, so you eat a hamburger, your pancreas says, oh, okay, he just ate a whole hamburger. Let me kick out some insulin. Because all of that, eventually that hamburger is going to break down and the cells are going to try to use it, remember?
Okay.
But it's too much carbohydrates, it's too much sugar in that hamburger. So the pancreas says, let me get in there and help with this crazy hamburger he just ate and get rid of some of that glucose sugar. Glucose is just sugar, okay?
Okay. Yeah.
Get rid of that glucose out of the blood. So the pancreas secretes insulin, and the insulin moves that glucose out of the blood into the cells. All right.
Okay.
So it says it from the blood and into the cells for energy for the body. So
Okay.
it's supposed to go from the blood uh to the cells and used for energy. But if it stays in the blood, that is when they say you have diabetes.
Okay.
You see?
So,
Right.
so
And
when
so that's why, look, when they prick their finger, they check their blood. You're going to be doing this as a nursing assistant. They'll teach you wherever you work. You prick their finger, they check the blood, they put it in what's called a glucometer, glucose meter, and it
okay,
tells you the number. And if it's too high, that means something's wrong with your pancreas. Okay? All right. And so if that sugar stays in your blood too long, it causes blindness, it
mm,
causes kidney failure.
kidney failure, blindness.
Yep. And it causes you end up amputation in your toes and feet. And if you drop something sweet on the ground in your house and you come back 4 hours later, what might be surrounding
Oh, shoot, ants.
ants, right? Because everything's attracted to sugar. So, just likewise, if you got sugar in your blood and you cut yourself, pathogens and microorganisms like that sugar. So you're going to have a hard time healing because those ants and microorganisms all over that sugar. You see what I'm
Okay,
saying?
gotcha.
That's why you can't risk having a sore when a person has diabetes. It won't heal. You see?
Okay,
Okay.
okay.
It won't heal. So there's two types of diabetes. There's childhood diabetes down on 107, type 1, and then there's type 2, which is the most common form, which is caused from your insulin not working or your body not being able to use insulin because you have insulin resistance from too much fat in your
Yeah.
abdomen area. There it means this often occurs when people are obese, okay?
Oh yeah,
Right? And so there's also pre-diabetes, gestational diabetes, and all of that, right? So you're going to read through all of that carefully because you will see a lot of diabetes. Okay?
gotcha.
Hypertension, diabetes, CVA strokes, COPD. Those are the hard hitters. Okay? Dementia. You're going to see a lot of that. Look on page 108, Cairo, down at the bottom, up under that glucometer. You see that glucometer? You see what it
Yep,
looks like. Okay?
yep,
You see the red, you see the blood on the tip of it?
yep.
That's what they're going to teach you how to do. Okay? Now, one of the main things you need to understand with diabetes, they highlighting it at the bottom, up under that glucometer. What does it say?
They say there are different types of equipment uh to um to measure glucose levels in the blood.
I'm actually talking about the guideline. So the G.
Oh,
That's okay. What does it
okay.
say?
You say follow diet instructions
No,
exactly.
where you at? Where you
Wait,
at? I'm
you said
talking
one.
about
You said the bottom on the A, right?
no, I'm talking about the first G up under the
Oh, okay.
picture, the
Proper
glucometer. What does it say?
proper foot care is
Vitally.
vitally important for people with diabetes.
Proper foot care. Because even a small sore on the leg or foot can grow into a large wound that may not heal. This can result in amputation. Okay?
Okay.
All right. So important. So you would associate diabetes with foot care, and you're gonna be doing that this week. You know, she told you foot care, we do real feet.
Yep, she told me that.
And if you get foot care in the as a skill, it's a real foot.
Oh man, okay.
Just get your feet together, or I have mine together, or whoever, Nicole, however it's gonna go, okay?
All right.
All right. Because typically, luckily you by yourself, because typically, the students do it with each other. All right. So read thoroughly, understand diabetes. So let me see an endocrine issue. So it says monitoring. So here's what the nurse and assistant can do as care strategies for diabetes. Monitor for signs of hypoglycemia.
Hypoglycemia.
That means low blood sugar. So what
Okay.
does hyperglycemia mean?
Uh, high.
High
High.
blood sugar.
Uh,
Okay. All right.
yep.
And then you got some other stuff, but we're not gonna go into that. But it's a lot of different endocrine issues, and this is what they want you to really, really know. Diabetes. You're gonna see it every day, all day. Okay.
All right.
Mm. So if diabetes, so here's a question. Would you expect a person with diabetes, if you have a resident with the diagnosis of diabetes, you may expect, true or false, a vision problem?
Oh yeah, true.
Very good, because
Yep.
it eventually damage your eyes. Very good, right? If
All
you
right.
have a resident diagnosed with diabetes, you can expect them to, as part of their care plan.
Oh,
No, I'm asking a question.
oh,
As
you.
part of their care plan, proper foot care to be a part of their care plan.
Right, okay. Proper foot care.
I'm asking you a question, true or false?
Oh yeah, true. I'm sorry.
True.
Okay,
Okay.
you did say true. True or
Very
false.
good, right? Okay. Um, all right, so let's go over to the reproductive system. We only got two left, two systems left. This is easy. The reproductive system, you got your sex glands called gonads.
Okay.
All right. Um, and for males, the function of the reproductive system is to manufacture sperm and the male hormone testosterone. For females, at the top of 109, I'm reading the reproductive system puts out estrogen and progesterone. So now that I have gone through menopause, like many of your residents and people that you'll probably be taking care of in this age group, I have stopped producing the hormone estrogen. It has affected my bones. Okay.
All
So
right.
now I need to do weight bearing exercises to help build my bones. Okay.
Weight bearing.
So, so that's what you can expect. And you should understand that if you see a woman my age and, they say, oh, my hip hurt. And you should say, wow, she's probably gone through menopause and may have her estrogen is causing her achy bones and muscles.
Okay.
You see what I'm saying? Right. And so
Yeah.
it's just understanding, right? So how the CNA can help on 109. Sexual needs and desires continue. Remember, we talked about that. They have their
Yep.
right to their sexual expression, right? And so the NA must respect this part, and inappropriate behavior is not a normal sign of aging and could be a sign of illness. All right. So let's say it says the nursing assistant must respect residents' sexual needs and never judge any sexual behavior. However, any behavior that makes the NA uncomfortable or seems inappropriate should be reported. So just because they have the right to express themselves sexually does not mean they have the right to make you uncomfortable.
Right.
Do you understand? And
Yeah.
so there's boundaries. Even as much rights as they may have, there's still boundaries. Okay. I could tell you stories. I'll tell them tomorrow. Okay.
All right.
All right. So over on page 110, you got some conditions that you can read through: vaginitis and BPH. Okay.
All right.
For men, right? Vaginitis for women and BPH for men. All right, so this is a short one and it's self-explanatory. You gotta, when women go through hot flashes, when women go through menopause, they're gonna have mood changes and hot flashes. And you gotta offer emotional support, right? Monitor for signs, if I'm aching, if the resident is aching, then maybe they need, you report to the nurse, she's having a lot of aching today. I think she's saying it's, her hip is hurting, and they may order her something for pain, anti-inflammatory, right?
Right.
All right. So, and then our last system is the immune system on page 10. This is what protects the body from disease causing bacteria, viruses, and microorganisms. All right, in two ways. The lymphatic system, um, and wait, what does it say here? Oh, about non-specific immunity and specific immunity. Okay. And you can read through this. I'm not going to read through this. They talk about over on page 11, HIV and AIDS. Just understand it. Okay. Understand what it is. Um, now let's talk about look over on page 112.
All right, 112.
The bottom of page 112.
The guidelines.
Yes. Okay. So follow standard precautions. Remember when we talked about infection prevention earlier in the program, and we talked about standard precautions versus transmission-based precautions. Remember that?
Right.
When we know someone has a disease that can transmit an infection, we handle that differently than standard precautions.
Oh yeah.
Right? And so TB, we know they have TB, so we're going to put on an N95
Right.
mask. We're not going to just put on a regular mask. We're going to put on a
And then
N95 mask, okay?
yeah.
So, but standard precautions is we're going to always wash our hands. We can always wear some gloves, right,
Right.
for people.
Okay.
We should treat everybody as if they're what?
Um, you know, uh,
Infected.
yeah, yeah, yeah. I
You be
think
you be overthinking, right?
I do. That's one
Right, you
thing.
be overthinking, right? You're gonna treat everybody as if they have an infection.
I was gonna
But
use. I
some
was.
people, when you know that they have a specific infection, you're gonna up your ante a little bit. You
Oh
go
yeah.
right. So we know that the person with HIV is not spread by air. So do you need a mask? Not
Now,
no, but you want to make sure now even when you are doing some of the basic things that you're wearing gloves. Because, remember when we were talking about some of the skills and I said, well, they don't require gloves for some of these skills, but when you're engaging in bodily fluids, you got to make sure. Well, when you have someone that you know has HIV, you might want to protect yourself even more with some
sure.
gloves. Now, you're also, guess what, when you wear those gloves, you're also protecting them from you because they have a compromised immune system. Okay. So
Yeah.
you might bring your stuff in there,
It's like
and next thing you know, they die from something basic because they couldn't fight it off coming from you. Do you see
right.
what I'm saying? So this works both ways. Don't act like, they just, oh, yeah, I don't want to get this from you. They don't want to get something from you.
Right.
See what I'm saying? Right. So they have a poor immune system function and are more sensitive to infection. So wash your dirty hands.
Yeah.
Okay. Keep everything clean for these people because they're fighting for their lives. Okay. And they don't have the strong immune system that you have. So think about sometimes, you never expect this to be reversed on you. Everybody, oh, HIV, HIV. Okay. Well, they're fighting for their lives. Okay. And so be careful what you bring to them too. All right. All right.
Right.
And so read through all of that. It's a great, need to have an understanding for these type of infectious diseases. All right.
Right.
And so then over on the other side, cancer,
Yeah.
we're talking about immune system and lymphatics. So cancer, a tumor is a group of abnormally growing cells. So what does it say over there on 113? Benign tumors means they're not cancerous. Malignant tumors are cancerous. Okay. Okay. Let me just go back to because I want to read what's in that blue box
Okay.
right there. You
All
see
right.
that blue box when it talks about residence rights on page 113?
Yeah.
It says, read what it says there. The facts about HIV and AIDS. Read that whole thing.
It said a handshake or a hug cannot spread HIV. This disease cannot be transmitted by telephones, tables, chairs, toilets, mosquitoes, or by breathing the same air as an infected person. NA should spend time with residents who have HIV or AIDS. These residents need the same thoughtful, personal attention that NAs give to other residents.
Think about if that was your family member.
Yeah.
Okay? That's it. You're supposed to be careful, but you should be considerate.
Oh yeah.
And they need that self-esteem boost too. They need that conversation too. They need that touch on the foot too. Okay? All right, they deserve it, right? And then you just finished reading about cancer, no big deal. And we are finished.
Oh, that's
And
it.
we are finished.
Oh yeah, it is it.
I am going to stop recording